the Philippines. Just to start by introducing myself and going through some of the background to this webinar and running through the running order today and introducing the panelists we have with us. So my name is Mark Chappell. I'm currently working across the Alliance and INEE on an exciting project to bring us together both networks and is looking to ensure both sectors work more closely together in the future. This paper, the policy paper, Weighing Up the Risks, has come out of this collaboration between the two agencies. And I'll talk a little bit more about the genesis behind that shortly, but first wanted to go into the webinar housekeeping. As you'll be aware, your audio and video are disabled. Please use the Q&A function at the bottom to post questions, and you can put a question up at any time you like. We have 30 minutes at the end of the webinar where we'll be taking the questions. So I'll be curating those questions and directing them to the panelists. So when you put a question in, please indicate to whom you want the question to be asked. Closed captioning is available. The session is being recorded. It's also live on Facebook. And after the event, the recording and the slides presentations will be hosted on INEE website. So yes, this paper, back in May, INEE and the Alliance came together, and we recognized that in the COVID crisis, many schools were being closed, and we felt that these were having a hugely negative impact on education and child protection outcomes for children, especially in crisis contexts, and really risking widening existing inequalities. Since May, and since our work done on revising and producing the paper, this has become a political issue in most countries, front page news in most countries, and as we're aware, certainly in Europe right now, schools are reopening at the moment. So this makes this discussion today more pertinent than ever. We do recognize this is a live issue, and so we're getting new and sometimes contradictory evidence, which is coming all the time from different contexts. And we do need to be highly aware of politicization of this issue. And today, very pleased to have representatives from INEE and the Alliance here to discuss the key points from the paper, as well as various colleagues from field locations across the world reflecting on the challenges they faced in trying to weigh up the risks in their context. So we have Hani Mansourian, who's the co-coordinator for the Alliance for Child Protection and Humanitarian Action. Kate Moriarty, Senior Advisor for Strategic Engagement Dialogue at INEE. Joseph Kajumba, who is a Principal Inspector for Technical Education at the Ministry of Education and Sports in Uganda. Juan Simon from Educo NGO in Guatemala. Gabriela Fontana, who's a Regional Health Advisor for UNICEF in East Africa. So today, after the welcome and introductions, we're going to play a short video to set the scene. And then I'll hand over to Hani and Kate to give an overview of the paper. Then we'll turn to Joseph, Juan, and Gabriela in turn to give their practical field examples. And then we'll have our debate and discussion of the main arguments during the Q&A. So again, please, comments in the chat, questions in the Q&A, and more than happy to hear from you. And if we can't answer the questions during the event, then there may be opportunities for follow-up with the individual speakers. So I'd also like to give a big thanks to the technical team at INEE who are supporting this, Peter and Lindsay and Alana and others who are making sure this runs smoothly. And so with no further ado, I'd like to hand over to Lindsay to play us a short video very kindly put together by Plan International, which we feel really illustrates some of the challenges children, young people, particularly girls, are facing during these periods of school closures. Thank you, Lindsay.
Extraño ir al colegio, extraño esa libertad que tenía.
I miss being around my peers and friends.
Já estudamos todas as matérias, não temos fichas, não temos ir como na biblioteca, nem na informática, e isso eu acho que vai me prejudicar.
Y me preocupa la educación, ya que no podemos interactuar directamente con los profesores para que nos expliquen las tareas.
La situación de las niñas en mi comunidad se visualiza más que se le encarga a las niñas para que ellas hagan las tareas del hogar, ya que no asisten a las instituciones educativas en estos momentos.
Apologies, we seem to have had a small technical issue there. If we're having challenges with the video, maybe we can move on to the first speakers and we can come back to the video later. It's really just, as you could see from that short excerpt, a chance for the voice of young people themselves to come through and really highlight some of the challenges they're facing in terms of trying to continue with schoolwork or access some of the other services that schools provide. So I'd like to hand over now to Hani Mansourian from the Alliance, who will take you through the policy paper with Kate Moriarty from INEE.
Sorry. Thank you very much, Mark. And sorry again to everyone for the technical issue on the video, but it is a very interesting video and the link was just shared by Sarah, so feel free to take a look at it. I'll just maybe, in addition to some of the background that Mark gave in terms of why we even embarked on developing this policy paper, just add a couple of things on that. For some of you who might have been familiar with other infectious disease outbreaks in other contexts, for example, Ebola or SARS or MERS, you might have had a chance to reflect on this question of the role of schools in a pandemic and how the closure of schools can potentially impact children. So personally, for me, this issue became really an issue of interest when I was in Sierra Leone during the Ebola crisis back in 2015. And after almost a year of school closures, when schools were being reopened, a lot of discussions came up. And unfortunately, I don't think those are documented very well, but a lot of discussions came up about the big question of whether closure of schools, especially for an entire year, was warranted or not, whether it did more harm than good, or did it do more good than harm. I don't think we had an answer for it at the time. And of course, Ebola is also very epidemiologically a very different outbreak than COVID-19. But the reason those questions were being asked was because we were seeing the negative impact that school closures had from the perspective of child protection and education on children. So teenage pregnancy going through the roof, which meant then that a lot of those girls were not able to go back to school even after schools opened. Issues of child labor and others came up. So part of why kind of we were alert to this issue was the fact that we were looking also at previous infectious disease outbreaks and seeing that the school closures that happened almost as a default when COVID-19 happened may need to be questioned in some context. Of course, context to context is going to be different, and Kate will walk us through some of the more contextual considerations that we have included in the paper. So when we were faced with the challenge of almost, sorry, I don't know, Lindsay, if it's possible to put the slides up. So I'll still go through it, but I can also, Lindsay, if it's not working for you, I can also try to share.
I can, this is Sarah, I'll try. I think we may have lost Lee.
Okay, great. Thank you, Sarah. So the big challenge that we faced, as outlined in the paper, we were dealing with 90% of students all around the world dealing with school closures. And that was the warning sign in that a lot of children who are already vulnerable will be pushed into more vulnerability by not having access to school and educational facilities, and the divide would start widening. We needed to push and advocate for this idea that there needs to be a balance between the health considerations that were the primary result of reason for school closures and all the other potential harm that can come from school closures. And that kind of gave rise to this paper. So we tried to ask some fundamental questions in this paper from the perspective of the three sectors. One being, are children able to effectively learn when they're out of school? Because a lot of the time the discussion was, of course, when they're out of school, they can still continue learning either with help from their parents or through online means. But is that going to replace or be nearly good enough for children not to fall behind? The second large question is from child protection perspective: can children be better protected when they're out of school or not? And that question in different contexts will have a different answer, but in a lot of the contexts where some of us work, especially in low resource context, the answer seems to be more leaning towards no, children are going to suffer from much more protection issues when they're out of school. And also they don't have access to the services that they would have through school. And then, of course, the issue of health, whether by children going back to school, we can still ensure their health. So I personally am really looking forward to the presentation from field colleagues, because they're going to put out discussions around all these three questions. The purpose is very much focused on when and why schools should be reopened. And I want to put a parenthesis there and say that it's interesting that if your question is whether we should close schools, meaning the default is that schools are open, and then you're asking whether we should close it, it's a very different conversation than when most schools are closed and you're asking the question whether we should open it, because it's always more difficult to argue against the status quo than otherwise. So we really try to focus on this question of when and why, and leave another question, which is how to open schools, to many other documents that have already been produced. And I think some of the colleagues are going to highlight those. So it's very important to not expect this document to answer how to open schools, because that's addressed in other documents. And it's encouraging basically considerations of all three sectors and weighing the risks for children and youth. We can go to the next slide, considerations. So across the three sectors, as I mentioned, the paper posits that school closures can negatively impact learning outcomes. They can negatively impact teachers' mental health and access to income. They can increase stress levels for parents who need to continue education at home. And these fall under the education realm. Under child protection, school closures can negatively impact mental health and well-being. It can lead to issues such as child labor and all sorts of violence. We now have data from child helplines that suggest that the number of calls to child helplines is soaring in many different contexts. And a lot of those are associated with the fact that parents just cannot manage the constant presence of children, sometimes multiple children, and children themselves are distressed, they're worried about their future, and all of that kind of leading to situations where children are become victims of violence. In some contexts, early marriage and teenage pregnancy is an issue. And in terms of health, the paper posits that it may not actually, school closures may not significantly reduce the risk. And lack of access to schools can also impact other things like access to nutritional support and possibly other health provisions that in some contexts children had through schools. If you can go to slide 7, please. Thank you. So basically this diagram, which is where I'm going to close, suggests that we need to put the child at the center of decision-making about whether schools should be open or closed. And of course, as I said, the default position in many countries was schools were closed. So that's why at the top of the diagram, you see schools are closed. But still, we suggest that there needs to be an assessment of risks from health perspective, from child protection perspective, from educational perspective, with a lens of best interest of the child and youth, and with a lens of do no harm. And these are, as all of you know, two very significant principles within the humanitarian and development work. And that structured analysis of these 3 areas should be what leads to answering the question of when and why to reopen schools. Of course, we are aware of the cyclical nature of this pandemic. In some contexts, the answer may change based on where you are in the cycle with the pandemic, but the principle remains the same. And I'll stop there and hand over to Kate Moriarty. Thank you very much.
Thanks, Hani, and thanks, Mark, for the introduction, and thanks for Hani to start and go through the first part of the paper. And then what I want to do is go through the kind of second part of the paper, building what Hani said, to think about how to, as Hani just said, the virus, the situation is constantly evolving and it's cyclical. So how do we contextualize the decision making around that? And that's really at the heart of what the paper's calling for. And I want to start just by saying that, you know, we recognise that it's really difficult decisions facing kind of national and local policymakers. These aren't easy times for anybody. And when you're trying to make decisions around these things, obviously a reaction, as we've seen, you know, more than 90% of students globally were out of school. So this was a reaction to close schools to prevent the transmission of the virus. However, as Hani's outlined, what we're really calling for is a more holistic, a balanced approach. That means decision-making must be contextualized. If we could go to the next slide. So in terms of contextualization, that means, you know, understanding the current understanding about COVID-19 transmission and the severity in children. It means looking at the local situation and the epidemiology of COVID-19, where the schools are located. And it also means about looking at school settings and the abilities of schools to maintain COVID-19 prevention and control. So there are some of the kind of contextual decisions that need to be, contextual considerations that need to be considered when making decisions about when and why to reopen schools or keep schools closed. And just to say, this paper, we made a point in this paper of not looking at the how to open schools safely, but we do point to resources from the UN, from the Global Education Cluster, on when decisions are made to reopen schools, how to do that safely. So if we go to the next slide, can talk about some of the paper sets out in the kind of third section of the paper. We set out a number of questions that can help make that contextualized decision making. So to go through some of these examples. So for education, an overarching question might be, what are the impacts of being out of school versus going back to school and educational outcomes? And you could ask the sample question, and as I say, there's many questions in part 3 of the paper, but a sample question might be, if schools are closed, what distance education opportunities are children and young people receiving? The same question for child protection, you know, what are the impacts of being out of school versus going back to school? And a question might be, what access do children and youth have to other mechanisms to report or seek support in relation to violence, abuse, neglect, or exploitation? And also we considered in the paper, you know, the health implications, not just in terms of COVID-19 transmission, but also other health considerations need to be taken into consideration. So again, the same question, what are the impacts of being out of school, going back to school, and the health of young children? And so one question obviously that's on everybody's mind, if schools do reopen, is there, you know, is the educational space sufficient to implement the adequate safety measures? But as Hani spoke about at the beginning, as you know, the motivated part of this writing this paper was, health-wise, are children any safer out of school? You know, because we know in a lot of contexts, crisis contexts, low-income contexts, children aren't able to social distance in the places they live, in refugee camps, in low-resource contexts. So if we go to the next slide, what we also included in the, as I say, in section 3, there's a whole list of questions for people to go through. They're just, those questions themselves are just kind of guiding questions, and they can be adapted to the context. And then we also included a kind of decision-making tool. Again, we said this isn't the only decision-making tool that could be used, but this is one. And so the purpose of this is, if you have a series of questions, you know, and then you go through the kind of, you know, analysis. This is obviously a very kind of top line visual of that. But, you know, if you ask those questions along the top of the diagram, you know, are children able to learn effectively when out of school? Are children well protected when they're out of school? Are children safer health-wise when they're out of school? And depending on what your answer is, you know, it may be that it's okay for schools to remain closed because they are safer out of school. It may be that children are no safer out of school than they would be in school. So, and we know that you know, it's a constantly evolving process. So it's not an easy analysis, but the key is to have that contextual analysis. And it'll be very interesting to hear from our 3 speakers in terms of their experience of working kind of at the field level. So just finally, just before I hand back to Mark, I just wanted to again say, you know, we do really recognise this is a complex issue, but we're calling for that balanced approach to, you know, to look at the bigger picture and to really think about what it means for children. You know, they're not just missing out on the kind of cognitive benefits of education, but also on the wider benefits that education brings. And also being out of school might mean they're exposed to more risks. So, you know, we're really grateful to see so many people joining the webinar, and we hope this is a dialogue, that you'll use the paper to have dialogue, you know, with decision makers, with your colleagues, with key stakeholders, with communities, and where it's appropriate and safe to do so, with children and young people themselves. So thank you very much. Handing back to you, Mark.
Well, thank you, Kate, and many thanks to you, Hani, as well, for giving an overview of the paper. Already had a few questions come in on that, so please do keep the questions coming in the Q&A, and we'll aim to answer them during the Q&A session at the end. And also during the Q&A session, we're going to have a bit of a poll, which will help us better understand the audience and the some of the challenges that you're facing. So keep an eye out for that during the Q&A session, and please complete it. I'd like now to hand over to colleague Joseph Ejumba from the Ministry of Education and Sports in Kampala. You know, as Kate and Hani have highlighted, it's the decision makers, the ministries, who are having to make these difficult decisions, whether to close or reopen schools, when and why. And we're very happy that Joseph's able to join us today to highlight some of the challenges and opportunities that he's seen in his role in Uganda. So Joseph, over to you.
Thank you so much, Mark, and all the organizers of this forum. And we'd also like to extend our sincere appreciation to all the participants who are listening in and all, and observing the events. Well, officially in Uganda, the schools were closed on 20th March this year, following the World Health Organization declaration of the COVID-19 pandemic and a case being identified. So when the education sector identified that need to close the schools, they advised the government to expeditiously ask the learners to get home as quickly as possible. This was also followed by a case which had been identified. This came at a backdrop of the development of an education sector response plan that highlighted the three scenarios. If the case is identified, what will happen? Or before case is identified, what will happen? If the case is identified, what will happen? And then as the disease progressed, what would happen? So very, very quickly, once the case was identified, a decision was taken to close the schools and ask the learners to get back home in the safety, presumably in the safety of their homes. Following that, the government took measures to ensure that learning continues so that the children or the learners who had been sent home are occupied in one or the other. So the Ministry of Education, together with our National Curriculum Development Center, developed a framework. And this framework came up with lesson packages that were used to deliver materials. These packages were based on the levels, the primary schools and then the secondary schools. And these packages were made in different forms. There were study home packages. These were printed and they were distributed, although they were not able to reach the country, the entire country at the outset, but it was possible to have them available in various forms. There were efforts also made to ensure that there were radio lessons that were done or presentations on the radio. These were live lessons and some were recorded. And then on television, the TV on that media, there are also lessons that were taught. And this was done by teachers live. There are also online uploads that were made. This way of delivery, however, had a few challenges as we were able to note. Age-wise, the very young learners, of course, with the one-way sort of communication, it was a challenge. So they were not adequately brought on board. Definitely with learning, the learners ask questions, there are issues, they needed clarifications, which could not be done instantly, typical of a classroom. The income levels, homes or families or communities without the various media, without television, without the access to the internet, and in quite a number of cases without access to the radios, they are definitely at a disadvantage, and they are at a disadvantage. Definitely with a socio-economic background, different communities would not devote time when the children are at home to learning. Instead, they would prefer to engage the children in other gainful activities, maybe related to agriculture or any other activities as the homes felt necessary. We also realized that the special needs learners were not well taken care of for this particular initially because of the different impairments related to either visual or hearing and others. So this one, the materials, of course, these learners were put at a disadvantage initially. Efforts were made later to make sure that these learners materials are prepared for them. But given the fact that contact was reduced or was minimized from the teachers and within the communities, these learners were a little bit of a problem. We, as a country now, we were really very, very much concerned that once with this continued school closure, the impacts are going to be very, very serious. We are really worried because we believe that there will be degeneration. The learners' level of continuity is going to reduce because they are affected in many ways. 4 or 5 months without school, the concepts are lost in quite a number, especially the lower learners who do not have the zeal to continue reading or attending to academic work. We also, something which we feel would also happen is that by the time the schools are reopened, some of the learners would not be interested anymore in academic work. And some of those, especially those who had taken on other income generating activities in support of their families or for their own. This could also be the problem within the adolescent category. We've already experienced, we already had cases being reported of defilement and early pregnancies and marriages. And this is also another very big challenge which has come up. Definitely the child labor the intensifying of the child labor activities can also lead to prolonged and general dropout of school. We do have, Uganda is home to close to 1.5 million refugees. And within these refugee communities, they are staying in very, very concentrated, more or less concentrated communities. They're near each other. So within these communities, we've also had cases of defilement, we've had cases of early marriages, we've had cases of early pregnancies, and also, that general lack of gainful occupation by the learners has quite a number of other protection issues, like we've already heard from Hani and Mark do a highlight. We will also believe that morality, the schools are responsible for keeping ideals, keeping the morals of the children and molding them into useful citizens. But once they are not together, once they're not in school, there could be this degeneration. And this could also create discipline issues once these learners go back to school or when the school resumes. We are also aware that because of the various reports we've received, that some of the parents may not, because of loss of income, because of the COVID-19 impact, these learners, some of the learners may drop out of school altogether, and this may be prolonged. We don't know for how long. During this break, we are aware the learners, quite a number of learners took on some activities which are income generating, and they have already started earning, especially these within the categories of those which can be, getting involved into activities that where they can gain income. They have already tested income, and some have also tested the work of the fruits of the labor. So we believe that quite a number of these who have gone into these different income generating activities may, when they go back to school, their thoughts will always drift back to the income, to the gainful employment opportunities that they may have got exposed to rather early. And this will definitely disrupt their schooling and their concentration in class. This will be to a very, very big detriment. Right now, the government has made extensive consultations with partners, with the key stakeholders in the sector, with the proprietors, with the parents, and all those who play a key role within the education provision regarding what and when and how the schools can be reopened. Our Minister of Health developed standard operating procedures and customized them for our sector use. We already have developed our own guidelines, which are being discussed by the various platforms within the country and by various forums within the country, so that these guidelines can support or can be followed should there be need to reopen, or once the declaration is made that the opening of the schools can be done. We are also very, very mindful of the three basic things: that hand washing, utilization of masks or wearing of masks, and the social distancing. These are very key elements within our standard operating procedures, like anywhere else in the world right now. But our biggest challenge are the big number of classes. Could probably be one of the challenges. Of course, we are aware of the learners, very young children, to keep the mask on for a long time. Although water or hand washing could probably be emphasized, but we're not very sure about the children. Will always ensure that they do that hand washing. So these are some of the things which are mind-boggling at the moment to the country. Should we open? If we open, shall our children be able to put on the masks every day for 5 days, for the whole day? Shall we be able to ensure that we shall maintain social distancing in classes which are having many more learners in quite a number of contexts than it should be? Should we, and shall we be sure that the social distances will be maintained? So these are the issues which are being discussed, and the president and the top leadership is consulting the Minister of Health and the National Task Force. Of course, there is also an input from the Ministry of Education and Sports Task Force. So all these are making an input. We've made tremendous strides, and we were now in the final stages of arriving at a decision, but the announcement and the final word will be done by the top leadership of the country. So for now, this is what I can allude to that topic. I thank you so much for listening again. Thank you so much. Back to you, Mark.
Many thanks. Many thanks, Joseph. Excellent timekeeping there, and really interesting to hear some of the challenges that you've seen in making these decisions, and also some of the impacts you've seen and are worried about with school closures. I think these are really some of the key issues we've been facing, we're trying to grapple with this paper. Connected to some of these educational concerns are some of the challenges around child protection with children out of school. And to highlight those, some real examples from the field, I'd like to hand over to Juan Simon from Educo in Guatemala. Juan, over to you.
Thank you very much. Good morning and good afternoon to everyone. Thanks for the invitation. It is my pleasure to share some data of the negative impact of school closures on protection. Before I start, I want to recognize the children as heroes and the real champions during the COVID-19 situation, because we often find hope and happiness with them despite difficulties. So next slide, please. I will ask support. It is important to mention a little bit the context of Guatemala. This is because in education, health, and nutrition are associated factors to the child protection issue. I agree that COVID-19 did not create inequalities in Guatemala, but for sure it is widening inequality and increasing despair as COVID-19 cases continue to rise. Guatemala has 17.2 million people, according to the national statistics. 41% of them are between ages of 5 and 19, so we consider ourselves as a young country. We as a country will have something called the demographic bonus. But of course, we think that without education, without health, or without child protection, we won't have this bonus, but maybe a demographic bomb because the levels of risk we have. The level of education is only 8 of 10 are in primary level. So this means that we haven't achieved yet the universal primary education. 4 of 10 in basic education, and 2 of them are in upper and secondary school. According to the situational analysis of Educo and also in UNICEF in Guatemala, there is around 1,600,000 youth out of school between 13 to 18 years old. So if youth don't have education, if they don't have life skills, we can face tremendous risks on social and economic problems. In terms of malnutrition, 5 of 10 children less of 5 years old have chronic malnutrition and lack of food security. So you can imagine the challenges that these children have in terms of their psychological, biological, and sociological development. 46% of the population are indigenous from the Maya, Garifuna, and Xinca peoples. Most of them live in the rural areas. About the topic of children and irregular migration, every year, around 20,700 children go to the United States. I think it's because the United States is so close to Guatemala. But since schools are closed, maybe more children might like to go to the United States, escaping from poverty, escaping from violence, and also would like to reach some of the members of their family. Next slide, please. According to the Ministry of Health in Guatemala, at the end of May 2020, in total, there were 46,863 pregnancies. It is sad to see that 9,962 pregnancies between 10 to 14 years old, 44,901 pregnancies between 15 and 19 years old. According to the public ministry in charge of the investigation of child abuse during pandemia, there were 3,821 complaints registered against adults relative for sexual violence against girls. So many families are afraid to report them because they live with the abuser at home. What can you do when the government tells you to stay home because of COVID? What can you do when the government tells you to stay home because schools are closed, but the sexual abuser is at home? Next slide, please. In terms of the violence, in total from March to June 2020, there were registered 5,259 complaints against adults for violence against children. EDUCO, during the situational analysis of children in 2020, found out that 1 of 10 adults considered using violence to discipline their children. It gets worse because in a meeting with a focus group, when adults were asked about violence, some of them agree, violence is normal. The Bible says to correct the children with a stick. So it is important to educate parents, especially the ones who have young children. What we have done in EDUCO is trying to work with local authorities about prevention, and we have agreements with local partners who know the fields. And they have divided the communities in 4 sectors, like the East, like the North, like the West and South. And if there is a problem in one of the sectors, the protocol of child protection starts, including the legal complaints if necessary. In 2 of the interviews with children about child protection, Martita, a girl from Quiché, told us, we believe that home is a safe place, but it's actually an unsafe place for us girls. Another person, another child told us, I am most worried that my mom and stepdad keep hitting me at home. So the decision of closing and opening schools should take into consideration these realities in communities. At home or in schools, children need to be protected. Next slide, please. So there is hope for children. For children, the concept of education and schooling are part of their lives. There is no dichotomies between them. For them, going to school is very important. In the middle of the pandemic, COVID-19, EDUCO conducted a survey, and I just want to highlight the question we asked and also the answer we received. The question was, what do you miss the most during COVID-19 while you are at home? And we were very surprised with the answers. And they said they missed going to school, 25%, play with my friends, 21%, visit my relatives and friends, 17%, go out and play outside, 15%, see my teacher, 11%. So this means that for kids, going to school is very important. And especially playing with their friends, I think it's very important. Because of that, we would like to make some recommendations. Next slide. Okay, the recommendations to policymakers. Ensure all first responders at the local level are trained and able to identify COVID-19 related child protection risks and know how to safely report and refer concerns. Ensure safe reopening of schools, including by establishing violence-free learning environment and support the return of all children, especially girls and those at risk of child marriage, child labor, and teenage pregnancy to school. Recommendation to parents, listen to your children and support their education from home and from school. If you as a parent, if your children ask questions about something that you don't know during COVID-19, don't be panicked. Do not worry too much. Nobody knows everything. Just show calm, speak to them with love, and make sure you allow children to express their emotions. I would like to end with the last slide with a recommendation to all adults. And this comes from the study of Small Voices and Big Dreams conducted by Child Fund Alliance. And I would like to recall that 9 in 10 believe that the most important thing adults can do to end violence against children is to love children more and listen to what they have to say. So policy papers like the one we are discussing today are calling to the attention of policymakers to listen to the voice of the children. So let's listen to the voice of the children. Many thanks.
Thank you so much, Juan. Very nice to end on a positive note as well. What a strong message coming through there from your experiences. So thank you for reflecting on that and sharing them with us. Before we move into the Q&A, we have one more presentation. And as most of the people on the call are aware, INEE and The Alliance are networks that cover primarily education emergencies and child protection and humanitarian action. But we recognize that for this complex issue, we really need to bring the voice of health into the conversation, to include it in the balancing of the risks and the weighing up of risks. And I'm very happy that our colleague, Gabriela, is able to join us from UNICEF in East Africa, and he will be sharing his presentation directly. So Dr. Gabriela Fontana, please, over to you.
Thank you so much. Please, can you confirm that you can see my screen and my face and you can hear my voice, all of that?
Yes.
Perfect, thank you. I see there are 225 of us on the call and only 4 have identified themselves in the pool as coming from health. And yet, the decision of closing schools very often has been taken on health grounds, public health grounds. And obviously, it's not in the interest of learning or keeping children safe from child protection risk to close schools. It's done because of public health reasons. So what I'll try to do in the next 10 minutes, and I'm very aware of the fact that I am the 4th or 5th speaker, it's taxing to be listening through a screen and a headset for long. I'll try to be quick, but also I'll try to focus on 4 main questions. The first one is, to what extent are children affected by COVID-19? Because if they're not, there is less ground to close schools. Do children contribute to the COVID-19 transmission? Again, if they don't substantially, there is less ground to close schools. Can schools operate while minimizing COVID-19 transmission risks? Can we make schools safe in different contexts? And is school closure an effective containment measure for COVID-19? Let me try in the next 9 minutes now to answer those 4 questions. Let's start with the first one. To what extent are children directly affected by COVID-19? Many of us, I have 2 children. One is 4 and the other one is 8. And obviously we're all concerned. Am I sending my child to school and exposing him or her to getting sick with COVID-19 and possibly very sick? Well, while each individual death is obviously a tragedy, mortality for COVID-19 in the region I've been living and working for 5 years now in Eastern and Southern Africa, in the region that I serve, is among children, deaths for COVID-19 are almost insignificant when they're compared to the overall preventable mortality. Let me show you. African children have been disproportionately less affected by COVID-19. This is from yesterday, from WHO, is a stratification by age of the confirmed cases of COVID-19 in the 47 countries that are covered by the Afro-WHO office, which covers also the region where I live and work. And side by side, I want to show you the age pyramid in our region. So what you can note immediately is that people below 20 are the biggest chunk, actually, the biggest proportion of the population, but they're very marginally affected by COVID-19. This is not deaths, this is just cases. The percentage of the population that is most affected is the one that are above 60. We don't have many in Africa, but we have them, and they're disproportionately affected. So what we can already see from here is that COVID cases distribution is opposite to the age pyramid. The younger you are, exponentially, the safer you are. And COVID deaths have this pattern in an even more extreme way, because there are very few children that die of COVID. So children in primary and pre-primary school age are the safest. Children in secondary school are still very safe. From 15 years of age up, we see the risk progressively going up, but really not significantly until your 20s. This is a breakdown of how many children had cases of COVID in Zimbabwe, Rwanda, Uganda, and Eswatini that my colleagues in WHO did for me manually, because it's not usually shared by countries. So it was done, now you see it's a bit old, it's from between mid-June and the beginning of July. On Monday, I should get the next batch of data for even more countries, and we'll see. But what is really clear here, first of all, there were no deaths among children. Little spreading among them. The lowest prevalence was in primary school age. And you see that between 84 and 98% of cases are above 18 years of age. So really children are not very much affected. Again, cases. Now let me use the example of South Africa. Again, this was published at the beginning of June. I'm now hoping that the National Institute for Communicable Diseases in Johannesburg will update this. But what is clear is that out of all the cases they had back then, almost 53,000, less than 6% were in children, and of those, only 1% died. They had 3 deaths back then in children. And now they have a few more, but what is still holds true is the proportion. And the fact that most of the children that died with COVID had very severe health conditions already, unfortunately. This is leukemia, cancer, dilated cardiomyopathy, which has a very low life expectancy, unfortunately, hypertension in children, and diabetes. So these are, unfortunately, children that were already significantly sick before getting COVID. In Kenya, this is from yesterday, and you have the distribution of deaths by age. Blue is male, orange is female. But what I want you to notice is below 20 years of age, we had 15 deaths. That's 2.6% of the overall deaths, okay? And they're mainly in infants and with children that have health conditions. Now, to give you sort of a perspective here, in the same period, basically the last 5 months, where we had COVID, we lost approximately 28,000 children, okay, under 5, 28,000 under 5. And we lost 5 to COVID between the age of 0 to 20. So again, the mortality for COVID is minimal among children. There are other reasons why children are dying: pneumonia, malaria, diarrhea in sub-Saharan Africa, for which we can do a lot to prevent, but we are doing a fraction of what we're doing for COVID. So the response to COVID doesn't benefit children much. Second question, and I have to go much faster. Do children contribute to COVID-19 transmission? Well, epidemiological studies and observation of what they call natural experiments, meaning countries that reopen schools during outbreaks, indicate that safe reopening of schools does not impact the outbreak trends. I'm providing here a few scientific articles that show how children are unlikely to be a major transmitter of COVID-19, and that children are not the primary drivers of COVID-19 transmission in schools or at home. This is an article again from Kenya from a couple of days ago that points to the fact that we have now 1,000 children with COVID in Kenya. At the same time, we have only 15 deaths, so 1.5% deaths. And what is becoming clear, and it's good that this is now coming in the press, is that children are not responsible for the major transmission of COVID. Between the last few days also, the article to the right is the BBC, the one to the left is the Guardian. They are mentioning a study that is on the British Medical Journal that came out recently, and that shows, they actually is the biggest study we have on children that fell ill with COVID. 651 children that were admitted in 138 hospitals in the UK. And the clear conclusion is that even when children get sick with COVID, they have much less severe acute symptoms than adults. Very few of them require intensive care. This is a different article from the New York Times, and I'm bringing it up. I have like a couple more of these articles. You see that they are on a sort of reddish background. These are articles that bother me, fundamentally because they misrepresent reality, and they end up raising concerns rather than reassuring people and giving an objective view of what the situation is, and the understanding that we have so far is for children and COVID. So this article claims that the rates of COVID among children is rising fast in the US. What they mention in the article, that for most of it tries to be balanced, but then it slips a bit at the beginning and at the end, is that what they call children is people up to 24 years of age. They have been all clustered together in the data they get from the States. And that they have disproportionately tested children more over time, which creates an artificial bigger number of children with COVID. And the vast majority of them are totally asymptomatic. Again, we're not trying ultimately to reduce the number of cases. We're trying to avoid deaths. Nobody worries about cold because cold doesn't kill. We worry a bit more about flu in population at risk because it does kill. COVID doesn't seem to kill children. Can schools operate while minimizing COVID-19 transmission risks? Now, we have evidence of countries reopening schools safely and plenty of guidance on how to do it, including in settings that have very limited resources. This is an article from the European CDC branch, Eurosurveillance, that shows how after reopening schools in Ireland, Iceland, Australia, and Italy, and Ireland, the number of cases did not go up. We don't have the time, but again, you click on it and you can access it. We have overlapped the outbreaks and the number of cases with the opening and closure of schools for different countries in our region, and there is no correlation between opening of schools and trends in number of cases. We have plenty of guidance. We have a framework for reopening schools with a set of indicators, a checklist now, to make sure that you do everything you need to reopen schools. We have an interim guidance that is an interagency one. WHO has published a checklist and considerations for reopening schools. We have even have guidance on safe journey to school and back, and nutrition in schools. In our region, most children get their main meal at school. Not going to school literally starves them. And finally, we are, this you cannot click and see it because it's in draft form, but I hope it will be ready next week. I can then circulate the link, is our guidance for Sub-Saharan Africa on how open schools safely in a way that is feasible in low resource settings. There are many concerns in terms of overcrowded classrooms, in terms of missing the facilities in schools even for hand washing. Physical distancing is different, using masks or not. And I want to flag, there is from last week an official guidance on using masks for children, jointly published by WHO and UNICEF, that you can access. And basically, over there you find by age groups when it makes sense to use masks or not. Children that are very small they tend not to comply with it and to misuse it. Doesn't make much sense. As children grow, it makes more sense to use masks. Here you have a glance of the different measures that one can put in place. And some of them can be put in place in a sort of out-of-the-box way. In Kenya, the Ministry of Health, we have not reopened schools here. I live in Nairobi, but all teachers have been requested by the Ministry of Education to report and to start teaching in the villages, small group of children, outdoors. We know that outdoors, the spread of the virus is it's basically 70% of the spread of the virus happens indoor. So outdoor is much, much less than half. And one of the strategies that has been adopted even in Northern Europe is to have small classes that don't interact with each other. So if you have a case, it's a small cluster of cases. It doesn't spread through the whole school. There are things that we can do, and we're doing them. I will not go into the details, but here, this is another article that I find particularly annoying because it was published in the World Economic Forum from Davos, and states that reopening schools too early could spread COVID-19 even faster, especially in developing world. This article is not a good article. It's based on a study made in Boston that assumes that children are not transmitting the virus when they're out of school, models the impact on reopening schools, clustering it with suspending all other containment measures, which doesn't make any sense, and overestimate the transmission using a model that was used at the beginning by the Imperial College in London and nobody uses anymore because we know that is overestimating the number of cases. There is another one, this was from Forbes. He stretched the content of a couple of articles. I knew the authors of one of the articles. I wrote to them and they asked Forbes to change and correct the article, which they did unfortunately only marginally. Last question and I'm closing. Is school closure an effective containment measures? School closure due to COVID-19 may actually not be an effective containment measure in many contexts, and this negative impact on children is likely to surpass its benefits. This is the countries that are in the dark orange have school closure completely. The one in mid-color orange partially have reopened, but still many groups are, and age groups at school still cannot go to school. Now, this is what happens when children stay at home in our region. Many of them live in a densely populated area with multi-generational households, and they're basically spending their time on the road playing and interacting with everybody else, becoming even more of a vehicle, if at all, of COVID in the communities. So closing schools is not a good idea in many contexts when you don't have electricity, an iPad at home, a room where the child can study, and a good program that the school follows. We have none of that. We have none of that. I'll skip. This is some of the things that we're doing now in the region to produce evidence, some of which I've shared with you, but is only the beginning. We're systematically now going country by country, producing evidence of the impact of COVID in children and advocating for that, supporting governments to find the right way to open schools safely, because we believe it can be done. So these were my 4 questions, and now you have the 4 answers. Children rarely suffer from COVID-19. They do not contribute substantially to COVID-19 transmission. Schools can operate minimizing COVID-19 transmission risk, and school closure doesn't seem to be an effective measure to contain COVID in many contexts, while the impact of school closure on children is in front of our eyes everywhere. Thank you so much.
Thank you, Gabriela. I think that's a very well received presentation, looking at the comments there. And I know that in many contexts, people have struggled with finding accurate and reliable information about transmission, particularly those of us who aren't from a health background. So it's excellent to have that input from you. So thank you so much for taking time and contributing to that. I'll move into the Q&A now. We're a little bit behind time, but I think it was really important to hear from all the presenters there. We did have a poll up earlier. It popped up a bit earlier. We might try and put that back up again to make sure we capture all the attendees. And that poll, really just a chance to find out who's here, where you're from, and some of the challenges you've been facing in trying to weigh up the risks in your context. Lots of questions around presentations and information that's been shared. It will all be collated and on the INEE website after this, along with the recording of the webinar. So thanks for your patience on that, you should get the information. Okay, I'm going to take some questions now. And first up, a question from Claire Nerenhausen to Kate. Are there mechanisms in place for navigating conflicting responses? For example, if children are able to learn effectively out of school, but their health and protection suffers, or vice versa, are some areas weighted over others? So this really gets to the crux of what the paper's about. Kate, I don't know if you want to take this question, and perhaps other panelists can come in as well.
Hi, Mark. I did, and thanks to Claire for the question. I did put an answer in the chat, so I don't know if people can see that. I think it is a really important question, and as I said, the decision-making tool that I showed on the last slide that I shared was, you know, obviously an analysis, a top-line analysis, and any kind of contextual analysis would need to go much deeper. And yeah, sometimes there may be conflicting evidence, and I think then what will need to be done in those kind of deeper analysis and conversations is really to think what is in the best interest of the child. But, you know, having listened to the different perspectives, I think we're seeing exactly how complex this is, and why, you know, if you're a government minister like Joseph, you may be having to take some decisions. If you're working in child protection, you're also hearing from children, you know, about in Guatemala, for example, how important school is, and then from Gabrielle, just how, you know, transmission rates among children are really low. But I still think that, you know, for each context, you have to look at what's happening locally and make decisions based on those. So hopefully that answers Claire's question.
Thank you, Kate, for that. And apologies to people if we don't get to your questions. We have so many of them, but limited time. And I know that colleagues from INEE and The Alliance have been answering some questions in the chat and in the Q&A. Another question I'd like to flag, some of these are a bit synthesized from a number of questions that have come in. One from Anna Tenorio, great to see you, Anna. And I'd like to take this to Joseph. Really, she's saying that we need to collaborate very closely with the Ministry of Education and the Ministry of Health to review evolving evidence, context mitigation, etc. But without the consensus globally on the evidence, the health implications, how can we best approach supporting governments to make these difficult decisions? And as someone from the ministry, obviously a lot of attendees are from UN agencies or from NGOs themselves. How would you advise they can work closely with decision makers in Ministry of Education, Ministry of Health, Ministry of Social Affairs to make sure that each sector is considered in decision making? Joseph, if you're able to take that and put your camera on, I'd appreciate that.
Sure. Thank you so much for that question and for the moderation. Really, the effort that has been done, we've had about a dozen meetings in the previous 2 or 3 months with the various stakeholders. And right now, because physical meetings are not possible, we're having quite a number of virtual meetings. We are bringing on board the education development partners and other key partners, and they are being encouraged to make contribution. The door is open. It's not possible to have everybody on the table at the same time, but the door is open for comments and through the various fora to give contributions on how best this collaboration. But technically, the Ministry of Health gives us the scientific evidence. For us, we only have to customize according to our condition, our situation within the Ministry of Education or within the sector. But right now, at this point in time, I can say that a lot of work and variable input has been secured from all the key stakeholders, including the partners, such that now we are able to make quite useful decisions. But of course, basing on the fact that there is always new information, new knowledge, which is coming on every other time. So I think a very good decision is going to be made towards the opening. Whether opening, actually, right now, there are quite a number, there are proposals to open, first of all, the finalists. So that means that there is a gradual process towards the reopening. Then after studying the events, then maybe further decision, and after weighing the conditions on the ground, then other decisions will be made in the course as we get along. Thank you.
Thank you very much, Joseph. And also just a point from some of the work we've been doing across both INEE and the Alliance, and some of the advice that's been given. Many of the questions are around how we can make schools safe, what we can do. And there's a number of guidance notes on the INEE website and the Alliance website, which are supporting those kind of questions, as well as some of the resources which Gabriela has highlighted as well. But locally, if you're not a member of your education working group, education cluster, child protection working group, child protection cluster, area of responsibility, please join that. And they can often be the vehicle for taking decisions and advocacy messages to the relevant ministries. Juan, your presentation was very well received, in particular the last points around child participation. And we're talking about weighing up the risks, and you mentioned around amplifying the voice of children themselves. Many participants are finding it challenging to get the voice of children and young people to the fore in these difficult times under COVID. Any advice or ideas or support as to how we can really raise the voice of children in this debate?
Yes, thank you. Well, I think the methodology of partners like children asking children is one of the key. When an adult approaches a child, sometimes it's different because of the complexity, and sometimes we adults, we don't think as a child anymore. But when you have, for example, teen talking to another teen and discussing issues about sexual violence, or talking about violence or abuser, etc., they open themselves. They can share more information about it. So I think we should take into advantage the groups we have in local communities. Of course, we have to keep working with the parents, and in focus groups, not necessarily just individual, but in focus groups, we can also ask some questions. We can hear some of the answers without, especially anonymous, we can work like anonymous, but we can listen to some answers. I think some of the statistics that I show, this is the official data we have in Guatemala from the Ministry of Health. And it is because of the complaints. Or for example, the first medical attention a child has in the community is the community health center. So from them, from that start, we receive some of the data. But for sure, some of the children, maybe they suffer violence at home, but they cannot even say anything. So I think we have to address culturally using the language, especially in Guatemala. The Mayan indigenous people, they have their own language. So what is the best thing to do is to talk to the child in their own language that they understand and create trust. And I think that's an important issue, to create communication, and they open themselves.
Okay, thank you very much, Juan. Very helpful. Next up, we have quite a key question, which has come in from a number of different attendees. Thank you very much, Gabriela, for your presentation. And I know many of us have been struggling to find this data, to get clarity on transmission between and across children, and infection rates and morbidity. However, one of the key questions which is coming through is obviously in schools, and at home, children are interacting with teachers, and at home with parents and maybe grandparents. Do we have data on the transmission rates from children to adults, and how can we ensure that teachers, some of whom may be vulnerable, can be protected if schools are reopened?
Sure, thank you, Mark. Let me address that. I realize I didn't talk about it, and it's quite important. There are several studies from South Asia and Europe that shows that children are almost never the first case in a household. It's much more likely that an adult gives COVID to a child than vice versa. There are like 3 different studies that coincide in that. But let me focus a bit on children. Yesterday, I was talking with a colleague from South Africa, and in South Africa, they're measuring a bit of everything. And he was telling me, we have so many teachers that got COVID. And I asked him, and how many electricians do you have that got COVID? Because you had your schools closed. Your teachers didn't get COVID in the schools. Most of your teachers did get COVID in the community. So let's not have a tunnel vision that now we think that every case of COVID in a teacher comes from a school. Not necessarily. The other piece of information that we need to keep in mind is that we can make schools the safer place for a teacher to be, because we can control the environment. We can control the environment when a teacher goes to the market to buy food, or when he or she goes on public transportation, but we can control the environment in the school. We can ensure that there is screening so that nobody that is sick is in the school. We can have hand washing facilities. We can make sure that the teacher wears a mask. Now, for teachers, as much as we're doing for health workers, if you are older, you have a health condition, or you have a precondition, like obesity or hypertension, you should be sheltered. You should not be exposed. There should be exceptions. These people should be protected. Now, this is much more of a problem in the US than in my region, where most of the teachers are slim and young. That's not the case in the US. So we have to obviously tailor this to the context. But we need to have these elements on the table when we think in a nuanced way on how to reopen schools. Schools can be the safest place. They used to be. They need to be, not only for children, also for teachers. I hope it helps.
Thank you very much, Gabriela. Very, very helpful, yes. And these studies you've spoken about, is there a way of including those links also in the presentation when you send it to our colleagues at INEE?
Yes, I can add a couple of slides with those links, no worries.
Fantastic, thank you. A number of questions have come in around the impact of the academic freeze or the suspension of learning. I'll just speak a little bit on that. We are hoping to commission some further research on that, and research is underway by a number of partners as well. But we do know from, for example, in America, when schools are closed in the summer, and some states, in some cases, for up to 10 weeks, they can see a drop in learning retention of about 50%. And that's in American schools, so it's not necessarily transferable data, but it's something which we recognize as a huge challenge. You know, in many contexts now, children have been off education for 6 months. And yeah, we hope to get some clearer data coming through from INEE Alliance partners as school reopens, as programs are starting, to really get a clearer assessment of the impact of school closures on learning and learning outcomes. Okay, sorry, just scrolling through the questions.
Mark, while you're looking through the questions, maybe just to complement what you've said, I think, you know, we've also seen evidence from UNESCO that so many children, you know, a lot of governments have made great efforts for distance education to keep learning going, but obviously we know there's much more to education, as I think one slide showed about children wanting to be in school to see their friends. But But also we know that you know, millions of children are actually locked out of distance education. So, you know, learning isn't continuing in any shape or form, and that really is reinforced by, you know, the most marginalized children, children in conflict and crisis settings. So I think, you know, that is a key consideration as well that has to be taken into account when looking at the balance between opening schools or keeping them closed. So just to complement what you said.
Thanks, Kate. I'd like to turn to Hani, if possible. We have a couple of questions around child protection systems, and how a kind of multi-sectoral systems approach to handling child protection concerns during the pandemic has generally been overlooked. So how can different agencies in different sectors come together to address and support some of the child protection concerns that we're seeing have been highlighted in the presentations today? So first to Hani, and of course, Juan, you're welcome to come in on that as well.
Sure, thanks a lot. Yes, I mean, I think part of the problem has been that protection systems and the social service workforce has, in most contexts, at least initially, was considered as non-essential workers. So we had all of these social workers and social service workers that were not able to do their work. At the same time, you have schools closed, which used to constitute in most countries the largest number of identification and referral of cases of child protection abuse and violence. So in the absence of these two, of course, we have been advocating for social service workforce to be considered an essential work. But in the absence of schools being open, and in at least the limited operation of social service workforce, the point that you're making, Mark, and from the question becomes even more important, that other actors, for example, health, become an increasingly more important partner with child protection and with education in addressing some of those issues. And it's purely the question of, I mean, at least partly a question of access. Communities don't have the same access that they used to have to be supportive of children and protect children. Teachers and school staff don't have that. Health and some of the other essential workers. So there has been, for example, examples of trying to use innocuous places like pharmacies or grocery stores as places to report some of the cases of abuse and exploitation of children. Of course, it's a very complex question, but in a situation like this, working with other sectors and other entities that some are not traditional partners of child protection become extremely important.
Thank you, Hani. Juan, I don't know if you had any comments you want to make to that question. If not, oh yes, go ahead, please.
Yeah, I'm sorry. Yes. Well, I think it's just we always have to work with local communities, parents, and also civil society if it's possible at the local level. And I think in my case, I see that one of the issues we have and we are concerned is that many girls might not come back to school because of the issues of violence. But it's because most of them also, because they have to take care about their siblings, like smaller children, sometimes they have to support at home. And many parents just prioritize and say, okay, you're a girl and maybe only the sons can go to school. So I think there are many issues, social issues, material issues, and the symbolic issues that can take into account in order to pressure to come back to school or not safely.
Thank you very much, Juan. And for the next question, I'd like to direct this to Joseph and actually look a little bit at the contrary to what we've been hearing about. We've been hearing about how school closures are affecting children negatively, and that does seem to be the overwhelming consensus. We are waiting for evidence, as we discussed earlier, but a number of the attendees have been asking around, actually, there is an assumption there that schools are protected places where quality learning takes place. Do we have examples of, positive examples of what has happened during the lockdown for effective learning to continue and protection to continue? And Joseph, I know you spoke about some of the methodology that you've used in Uganda, but yeah, I wondered if you could highlight any positive examples where learning's been able to continue, even thrive during lockdown.
Yeah, thank you so much for the question. Really, one thing for a fact is that at the outset of the pandemic, it wasn't very clear for how long this challenge is going to last. For our country, the lockdown was initially for 2 weeks, then eventually, after that, another 2 to 3 weeks, and then it continued like that. So right from the onset, no long-term programs had been initiated, although remedial ones were prepared quickly, but nobody had anticipated that it would be 5 or 6 months down the road without children going to school. So some of the plans that were made were not very, very specific in terms of ensuring long-term learning while at home. And the issue of protection, the president clearly indicated that it's important that during this scenario, the children are safest in their homes. Regrettably, because within their homes, the parents are there, it's assumed that the communities can have a look. Regrettably, in quite a number of instances, we've already received the cases that, of course, outside their homes, there have been cases of defilement, and even with the knowledge of co-parents, there have been some early marriages that have occurred, and all these are not very good development. But we can say that I think the impact may not be immediate, it may not be seen. But another thing we've seen is that within the various communities, children got involved into activities of some kind. Although it's very difficult to draw between a dividing line between child labor and gainful employment activities, but the children have got involved, sometimes supporting the learners where they're working, something which had not occurred before. Over time, maybe these learners may actually realize that in addition, even if you've attained levels of education, but this type of skill once obtained, it can be very useful. We've got cases of children who took on to farming within the small compound, using sacks and growing various vegetables within the compound. Some have gone to work with their parents where they work and have supported into the various activities. So in one way or the other, they've been introduced to the world of work. It has its advantages, although it has also its own disadvantages. And then the protection, really, that's a very tough thing. It has been a very big challenge. Nobody had anticipated. The cases of defilement and early pregnancies, as reported by our medical authorities, the cases are rising. And this is a very, very, very big concern. Would really say that this is a very big challenge. Although the parents have also now learned that they need to put a lot of emphasis, keep an eye on their children as much as possible, other than previous thinking that once they're in school, they are safe. I think these have been eye-opening opportunities for the parents, for the communities, for the government, and especially to come up with the programs and interventions that can always take care of the children, even if when they're at home. Thank you.
Thank you so much there, Joseph. Sorry, I was on mute. We're drawing to a close now. I think there was a number of questions that came through. There's a very quick one for Gabriella, which was, if children are low transmission risk, do they have to wear masks? And is it safe for them to wear masks? And we've seen a lot of a lot of media, a lot of propaganda in some cases around mask wearing. So I think many of our participants would like to get a little bit of steer on that.
Okay, I will, in my presentation, I'll add also a link to the recent guidance from WHO and UNICEF on children and wearing masks. Basically, what the guidance says is below 5 years of age, there are very few children that are able to wear the mask properly, so it doesn't make much sense. There might be few exceptions if children are particularly sick and you need to have them moving around, but otherwise the advice is not. Above 12 years of age, usually children are able to wear a mask and wear it properly. So the advice is, yes, align with whatever policy you have in place for adults in any given country. The age in between 6 and 12, is where is a judgment call. As in this age, between 6 and 12, as children grow, they're more and more able to wear masks properly and effectively. And when that's the case, they can do so. On the younger one, it might be a bit more difficult. Again, there is a provision if children have conditioned themselves for which they have to protect themselves a bit more, or live in a household where somebody has a condition, and then is to protect the relative in the family. This is, let's say, grosso modo, the content of the guidance is obviously much more nuanced and gives you a bit more insight on how to go about it. Happy to share it. I know we're on time. There was a contribution from Ali from Indonesia. I'll answer in writing. He seems to be very familiar with his numbers, and I think I can address that offline. But there are some countries that have a bit higher prevalence of COVID in children, which is not an issue. Again, is a matter of mortality. You have 155 deaths in children for COVID in Indonesia, but you have a few million children dying in Indonesia every year for other preventable causes. So again, it's a matter of understanding where the balance should be. There is no easy answer in many cases.
Thank you, Gabriela. And yes, many of the questions will also be shared with the panelists, and where possible, we can't guarantee, where possible, some of the key questions we may follow up with some of the attendees. But I'd like to thank everyone for joining this very illuminating webinar. In particular, our speakers, Joseph Kajumbo from the Ministry of Education in Uganda, Juan Simon from Guatemala, Dr. Gabriela Fontana from UNICEF East Africa, Kate Moriarty from INEE, Hani Mansourian from the Alliance for Child Protection, Humanitarian Action, and of course, huge thanks to the INEE technical team who have kept this flowing smoothly, Lindsay, Sarah, Elena, and Peter. And thank you all for your questions and attention. Very, very well attended and very well received webinar. Please, if you're not a member already, sign up to INEE or the Alliance. Please consider how you can work across child protection and education emergencies in these difficult times. And please check in on the website for all the resources that we've shared today and other resources about safe school reopening. Thank everyone, and goodbye.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you. Bye.
Thank you so much. Thank you so much, everyone, and have a good evening and good morning. Thank you.
Bye, everyone.
Bye.